Welcome, Dr. Aula.
Cool. Thank you very much, both of you, and very welcome everyone to MSF Scientific Days. And I'd like to thank the organisers for the brilliant work that's gone on behind the scenes to what I hope will be 2 very successful days. So what I'm going to do is start with an introduction for the antimicrobial resistance session. So as many of you will know, antimicrobial resistance is one of the greatest challenges that we will face in healthcare in the coming years, both in terms of morbidity, mortality, cost, effect on the health systems. And arguably, COVID-19 has, as it has many other things, adversely affected the strides that we have been making in antimicrobial resistance. We struggle with antimicrobial resistance in high-income settings in Europe, in the US. However, the burden is great and probably increasing in low and middle income settings. Obviously, that's a term that we try not to use so much, but it describes countries where there may be increasing use in antibiotics, perhaps less regulation, more over-the-counter use of antibiotics, and increases in degrees of antimicrobial resistance, with particular rises in resistant gram-negative infections, but also gram-positive infections. When we discuss antimicrobial resistance, I always want to highlight that it's not just the normal bacteria that we think about that are of issue. So mycobacteria, so particularly drug-resistant TB, extensively drug-resistant TB, but also parasitic infections such as malaria are other challenges that we face in terms of rising resistance. And the challenges to addressing this are multifold, often complex, and it's been very interesting and exciting to see an increasingly multidisciplinary approach to how we address and tackle issues around antimicrobial resistance, though arguably we have a lot more that we can do in terms of One Health, bringing together key actors and really understanding the issues and addressing them both at the international level, but also locally among communities. And I think it's excellent that Dr. Farhat highlighted how we don't want to be thinking of patients as beneficiaries, but people who are fully engaged in their care, advocating for their care, informed about their care. And so coming from within local communities, because that's the only way that we are going to be able to affect change and misuse of antibiotics at the very local level. One thing that it's important to highlight, particularly with the work that MSF does, and we'll be hearing from colleagues later in the day from Gaza, Lebanon, Syria, Haiti, and elsewhere, who'll be discussing various innovations around antimicrobial resistance in these settings, are the humanitarian and conflict settings, which present even greater challenges with regards to antimicrobial resistance. Often in these countries, the health systems have been devastated not only by conflict, but also by underfunding, poor governance, poor management. And what this means for patients is that they are increasingly susceptible to the transmission and the acquisition of resistant organisms, which can leave them with lifelong problems, including high personal costs, high out-of-pocket expenses, but also in the example of chronic wounds, or particularly those who have metalwork or prostheses in place, significant challenges in being able to continue with their normal day-to-day lives with significant social impacts for them. And that's why I think it's important for us to remember situations where there has been humanitarian crises, conflict, but of course they don't always only just affect the health system, but also have other effects. So for example, patients themselves might face malnutrition. They may, in some of the contexts, face non-communicable diseases. So for example, diabetes, which can alter the way that their bodies are able to fight infections and deal with infections and their susceptibility to infection. Of course, a lot of countries that MSF works in, patients are immunocompromised, whether with HIV or other factors. So it's really important for us to take into account all of these factors when we consider our programs. And of course, MSF have some very successful programs which are aiming to tackle antimicrobial resistance in a way that is holistic, which of course includes infection prevention and control, antimicrobial stewardship, and also input from anthropologists, which is increasingly important for us to really understand what's happening at the ground level in the different contexts in which we work. So I'm very excited today that we will be having a range of speakers who will address some of the innovations, particularly those which are sustainable in the way that we want to tackle antimicrobial resistance, both locally and also internationally, both within MSF and outside of MSF. And I'm very excited that we will not only have MSF speakers today, but also other specialists, microbiologists, infectious diseases physicians, and others who are bringing together innovations in the humanitarian sphere which are adaptable to the local context, which have great promise. So for example, we'll be hearing from Nabil Karrah about the telemicrobiology project that has been implemented in Syria, which is among the worst of the conflicts, and arguably a significant impact and source of antimicrobial resistance, given the impact on the health system of the protracted conflict. So I'd very much like to welcome you over the next 2 days for the MSF Scientific Days, and I'm going to hand back to Aditi to introduce our first session.